what we'll do now is turn it over to Sona Mohnot from the Greenlining Institute. Sona is the Environmental Equity Senior Program Manager and Policy Analyst, and she's going to share recommendations as to how climate and health equity policymakers, planners, and advocates can advance equitable climate resilience. So we heard from Rebekka on some of that assessment piece, and I think Sona is going to bring us a little bit further down the action. So we're really looking forward to your presentation, Sona. Over to you.
Thank you so much. And I just want to make sure, can folks hear me okay?
I'm hearing you well, Sona. I'm hoping that the chat box will give us a thumbs up.
Okay, great. Thank you, Pema. Hi, everyone. I hope you're all doing well. My name is Sona Mohnot. I'm speaking from Oakland, California, and want to acknowledge that I'm located on stolen land of the Chochenyo Ohlone. As Pema mentioned, I'm a senior policy analyst on the environmental equity team at the Greenlining Institute, and we're thrilled to have an opportunity to share some of the work we've been doing on climate and health equity. For those who may not know, Greenlining is a racial and economic justice public policy organization based in Oakland with a mission to address the harmful impacts that redlining policies created in low-income communities of color. And this is a great week for us in the U.S. to be speaking on this topic, as we just welcomed a new president and administration that is prioritizing racial justice and climate change. And so the presentation I'll be giving today is on a report we published on how to make equity real in climate adaptation and resilience efforts. And what I mean by making equity real is that I'm sure many of you all know that equity is a pretty popular buzzword these days. The idea of centering social equity is becoming more mainstream, which is great. And at the same time, we want to make sure that we're not just talking about equity or making a commitment to it, so that we have actual strategies to make those commitments actionable and real. So today I'll be sharing a framework on how to make equity real in climate and health equity work. Next slide. So here's a quick overview of the presentation. First, I'll provide an overview of why social equity, including health equity, matters in climate resilience with a specific environmental justice lens. Then I will be introducing our Making Equity Real framework. And finally, I'll offer some examples of how the framework can be applied in policy or planning work. And I'm hoping that by the end of this presentation, everyone listening in will have increased knowledge about why and how climate change is a public health emergency, that participants understand our framework and how it can be used to advance equity in health and climate resilience work. And finally, that examples we share on how to make equity real in the California context can serve as a model for equitable health and climate resilience work in other geographies like Canada. And so before diving in, I want to share some definitions for adaptation and resilience, since the two terms get used interchangeably but are actually two different concepts. It's helpful to think about climate adaptation strategies as actions that can build resilience to climate impacts. For example, let's say there's a neighborhood that is prone to extreme heat, like the image on the top, but has no tree canopy to provide shade and cool down the area. An adaptation action would be to plant trees that provide shade so people can spend time outside. And this action will help build resilience to the extreme heat because people will be better able to cope with the heat with the trees. For instance, children can play outside, people can walk or bike more, and the tree canopy will improve the air quality since trees can help sequester carbon. Next slide. And as we dive into climate resilience, I want to ground us in outlining the visions we want to achieve here. If you ask 10 people what resilience means, you'll probably get 10 different answers. And so I wanted to unpack this term a little bit more for this presentation. The image on the left is from our partners at the California Environmental Justice Alliance. And it gives us one picture of what resilient communities can look like. We want our communities to have clean energy, active transportation, access to healthy food, healthy air and water, green spaces to be outside, affordable housing, and access to healthcare. And communities with this type of deep community cohesion are ones that can respond well to climate disasters. So in the short term, to achieve this vision, it means we have to prepare neighborhoods and people to cope with and respond to this new climate reality. But in the long term, it's fundamentally about building power and addressing underlying systemic inequities that are oppressing low-income communities and communities of color. And that's what this image on the right represents. And so I wanted to start with this vision because our report that I'll get into soon outlines strategies towards achieving it. Next slide. So now I'd like to start with providing an overview of why equity matters in public health and climate resilience and how these are all related with an environmental justice perspective. In short, as we just heard, the climate crisis is a threat multiplier, especially for communities already suffering from environmental and health injustices. In the US and around the world, there are thousands of communities, usually low income or with many residents of color, that already face environmental risks and are constantly dealing with injustices that other people generally don't experience, like being exposed to extremely high levels of air pollutants from fossil fuel plants or water contamination from dumping coal, ash, or lead into water supplies. For instance, I grew up in Louisiana, and we're home to an 80-mile stretch of land known as Cancer Alley because it has over 200 petrochemical facilities. The area consists of predominantly Black residents, many of whom live within a few miles of a hazardous industrial zoned facility. And there have been so many cases of cancer, so much inexplicable illness and death that this corridor has become known as Cancer Alley. And while Cancer Alley is in Louisiana, these same types of environmental justices happen all around the US and the world. And oftentimes, these same communities often lack access to fresh produce and food, public transportation, healthcare, good education and job opportunities, and affordable housing. And since climate change exacerbates these existing health and environmental inequities, low-income communities and communities of color, particularly Black and Indigenous populations, are often hit hardest by climate change and have the least resources to adapt. But as we know, these injustices did not just show up. They're the result of generations of discriminatory and harmful policies that have created severe health and environmental burdens in low-income communities. And in the US, the location of Black and brown communities near pollution sources like fossil fuel plants comes from discriminatory government policy known as redlining, which began in the 1930s. During the Great Depression, families were struggling to make ends meet and were defaulting on their mortgages. And so in response, federal agencies started providing government-backed mortgages to help families build wealth through the Depression. But not all families received help. Government agencies worked with bankers and realtors to create maps to identify which neighborhoods to invest in based on credit risk. And Oakland, where I'm located, was one of these neighborhoods, which is what this map shows on the screen. Governments and realtors created a grading system based on several factors like quality of housing, but the primary indicator of risk was race. The neighborhoods were graded based on a color code that you can see on this map. Green meant best, blue meant still desirable, yellow meant declining, and red meant hazardous. And areas that were redlined were seen as credit risks because of the presence of people of color, especially Black people. And this is where the term redlining comes from. The image on the bottom of the slide here is an audit for the city of Oakland, and it was common to see offensive language like infiltration of Negroes and Orientals listed as a detrimental influence in the neighborhood, and the reason for the area's redlining. And between 1932 and 1962, in the US, the federal government backed over $120 billion of loans, and more than 98% of that money went to white families. And so at a time when white Americans were building wealth to fund their children's education, buy homes, people of color were largely shut out from those opportunities, which has led to the extreme wealth inequality and racial wealth gap we see today. Next slide. And redlining didn't just impact economic conditions. even though redlining is technically illegal now, we still see the harmful health and environmental impacts from decades of underinvestment and discriminatory policies in communities of color. And in fact, in California, a 2018 agency analysis shows that 89% of people in the poorest, most polluted communities are people of color. And this image compares the Oakland redlining map that I just shared on the left with a current day map of the same area that identifies places most affected by pollution and socioeconomic conditions. The areas in red and orange are the ones experiencing the most pollution, poverty, and pollution-related health illnesses like asthma and cardiovascular disease. And what you'll notice is that the red and orange communities on the right that suffer the most today are the same communities that were redlined over 80 years ago. And this disproportionate exposure to pollution leads to higher rates of asthma, cancer, and other pollution-related illnesses. And it's important to note that while redlining was one government policy that created inequities along race lines, it's certainly not the only one. Next slide. As Pema mentioned at the beginning, we often hear about the long history of discriminatory policies in the U.S., from the founding of the country on the genocide of Native people, to slavery, to Jim Crow laws, to the Chinese Exclusion Act, to Japanese internment, to ICE detention centers, and excessive police brutality toward Black people that we see today. Race has always determined the winners and losers in the U.S. and in so many other countries, and centuries of discriminatory policies essentially put handcuffs on Black, Indigenous, and people of color from being able to accumulate wealth, power, and resources. And in the policy work that we do, it's important to remember that these policies and history were not created by just a few bad actors, but were all deliberate public policy decisions carried out and implemented by government institutions. And this is the message that we want our policymakers to hear and understand, is that while government played a significant role in creating these injustices, it can and must also play an important role in addressing them. And while this history that I've shared is specific to the U.S., the takeaway here is that the health and environmental justices we see today across the globe in poor communities and in Black, Indigenous, and communities of color did not just show up, but they're the result of generations of harmful policies, as Pema shared at the beginning of this presentation. And so as we move forward and develop new policies, we have to acknowledge that race-based policies and plans created and continue to perpetuate the inequities we see today. And you all might also be wondering why I spent so much time on this historical context, and it's an important question. But as we work to address and undo the harms that marginalized communities have experienced for generations to build healthier and more climate-resilient communities, it's critical to understand that time is spent on learning the history before moving into actionable steps, that we need to move forward, but also make space to understand that the grieving and healing and trauma work is part of this work, especially in the context of public health and mental health, because so many marginalized communities carry generational trauma. Next slide. So coming to present day, what we see today is the cumulative effect of discriminatory policies that has resulted in poverty, pollution, disinvestment in low-income communities and communities of color. And when you add climate change to these conditions, it leads to a climate gap where poor people and people of color are disproportionately impacted by climate change. And that's what a lot of these headlines illustrate. Low-income communities often lack the resources that can serve as a lifeline during climate disasters, like having access to a car or living near safe transit options to escape a climate disaster, or having savings in case you need medical attention or experience unemployment. Next slide. And as we just heard, because climate change exacerbates existing health inequities, it's why policymakers, planners, and others in government should think about how to work at the intersection of the climate and public health crises. These crises don't exist in silos, but are interconnected, and our strategies to address them should similarly be interconnected and comprehensive. In California, we don't have to look far to find examples of this. Last summer, the state was in the midst of COVID, a respiratory illness, and then also had one of the most devastating wildfire seasons, a climate disaster that led to weeks of smoky air that was unhealthy to breathe and was especially dangerous for people with respiratory conditions, including COVID. And these new crises hit low-income and communities of color hardest due to the already high levels of air pollution and unhealthy conditions present in these communities. And so as we're thinking about developing strategies to improve health conditions and build climate resilient communities, it's critical that we center equity in those strategies to protect our most impacted communities. Next slide. And to do this, we need strategies that provide comprehensive, multiple benefits to impacted communities. The strategies that we advocate for to build true resilience are the ones that, as this slide shows, build the resilience of physical environment, create better health outcomes, enhance economic opportunities, reduce exposure to pollutants, and continuously engage and empower communities throughout every phase of planning to implementation. And not only do we need this multi-pronged comprehensive approach, we also have to make sure it's equitable. next slide. I'm sure many of you have seen this iconic image, but I want to clarify what we mean by equity and be clear that equity is not the same thing as equality. Equality is the assumption that the playing field is level, whereas equity acknowledges that people are starting from different places because of systemic injustices like redlining. Equity is about increasing access to power, redistributing resources, eliminating barriers to opportunity, and empowering marginalized communities to reach their full potential. If we're not intentional about centering equity, it will be easy for things to fall into business as usual, to maintain the status quo, and to continue perpetuating environmental and health injustices that we currently see. So now I'd love to share our Making Equity Real framework as one tool we can use to help us build healthy and climate resilient communities. Next slide. So if there's one thing about this presentation that you walk away from, it's these 4 steps. For any health and climate resilience policy or plan, equity has to be embedded in these 4 categories. First is goals, vision, and values. And this really gets to how is equity described in the context of the overall goal of the policy or program? Is equity a core component or is it missing? Second, equity has to show up in all processes. And this really gets to asking, how does the policy or program deliver outcomes with equity as a focus? How are decisions made or influenced by communities with less political power or voice? The third step is implementation. How does implementation lead to equity outcomes? What are the explicit equity outcomes that are described in the policy or plan? And finally, the last step is analysis. Really asking, how is equity progress being measured? And how do we know that our equity goals were achieved? Our theory is that equity has to show up in all 4 categories to create the strongest outcomes for communities, and that we have to be explicit about it. The concern is that when policies and programs or investments are developed without an intentional consideration of equity, racial inequities are likely to be forgotten or reinforced, or in some cases, exacerbated. And so I'll go into each step right now in a little bit more detail and provide an example. Next slide. And so for goals, equity cannot be just a talking point. If a public health and climate resilient effort is serious about creating equitable outcomes, it has to make that explicit in the goals of the effort. It's helpful to first learn about the intersections of climate change hazards and health in the community you're working with, and then apply an equity lens to those intersections. A good example that we like to point to is the Los Angeles Countywide Sustainability Plan. The plan has 12 goals for a sustainable LA County. And the reason why I use this plan as an example is because equity is not one of the 12 goals, but it's built into almost all of them. And by weaving equity into all of the sustainability goals that focus on public health, climate resilience, economic opportunity, and others, the county will be able to tackle multiple existing inequities that communities face. And so I have some examples on this slide about how the goals reflect equity. For instance, goal number 1 here is to have resilient and healthy community environments where residents thrive in place. And the goal explicitly says that the county will protect low-income communities and communities of color from pollution and reduce health and economic inequities. Goal 10 is for a sustainable and just food system that improves access to affordable, local, and healthy food. And we really like this example from the Los Angeles County because it shows how public health and climate issues are connected, and because it does not silo equity into one goal, but equity shows up in all the goals, which is what we want to see because our communities require intersectional strategies to truly build resilience. Next slide. In the second step, equity has to be built into the processes of an effort to ensure that communities have opportunities to influence and drive decisions. A good example of an equity-centered process is Los Angeles County's Measure A, which passed a few years ago and aims to provide safe, clean neighborhood parks and beaches for the county. As part of the process, the county approved a comprehensive parks and recreation needs assessment to find where are the most park-poor areas in the county. And the map on this screen shows each area's park need, with green being very low and red being very high. And this process involved a lot of community engagement. It included workshops for over 170 study areas where residents could review their neighborhood's parks and create a list of projects and prioritize them. And the workshop and the outreach materials were available in Spanish, Chinese, Korean, and Armenian to make it accessible to residents who didn't speak English. The data from this assessment can now be used to equitably allocate funds in high park need areas while also addressing the specific needs of each community that came up through the workshop. And adding more parks and tree canopy in park-poor areas is a really great strategy to not only improve health outcomes, since trees can sequester carbon and reduce air pollution, but it can also help build climate resilience by providing shade on hot days and promoting active transportation like biking or walking. Next slide. And this process step that I just was speaking about that focuses on community engagement is extremely important, but in our experience, it is also one of the more challenging steps to do well. And I wanted to share this chart here. I'm sure this is familiar to many of you. This public participation spectrum developed by IAP2 provides different stages of engagement, from inform, which is the least engaging, to empower, which is the most engaging. And the spectrum starts from only informing the community about a plan or policy, and it's pretty much the bare minimum. The promise is that the government entity will keep the community informed, but it does not include an opportunity for input or feedback from the community, and there's no two-way dialogue with the community. Example activities under this stage include things like fact sheets and information on websites. And on the opposite end of the spectrum is empowering the community. This is the most equitable and transformative stage of engagement. The goal here is to let community members have final decision-making power over a policy or plan, make sure that the plan is something that responds to community-identified needs, and there's a lot of deference given to community expertise and knowledge. And example activities under this stage include resident juries or ballots. And in between inform and empower are other stages like consult, involve, and collaborate. In our work, we see a lot of agencies at the involve and collaborate stage and are working to get toward the empower stage to help shift power dynamics between community members and government and give people more power and ownership to drive decisions that affect them. And this is a helpful tool to assess where a local department or agency may be at with their engagement and to set goals for where they can grow. And one thing I wanted to note is that while we want our government partners to be at the empower stage it can be quite harmful to overpromise what power or decision-making influence a community will have over a policy or plan. If there's no trust or meaningful relationship built yet between a government entity and a community, then it's not realistic to say that the engagement will be at the involve or collaborate stage. And this can cause already oppressed communities to experience additional trauma and can harm the relationship the government entity is trying to build with the community. We always suggest government conduct a self-assessment to see how much staff capacity, financial resources, and time they have for a project before deciding what the engagement strategy will look like. And in general, some best practices are to compensate community groups and individuals for their input, to provide continuous updates about how the community's input was incorporated or explain why it wasn't, and make sure that there are checkpoints for feedback throughout the entire process, not just at the beginning. Next slide. And the third step here, the next step, is ensuring that implementation of a policy or plan actually leads to equitable outcomes. And this requires understanding community-identified needs through surveys or focus groups or workshops, and developing implementation strategies that respond to those needs. And the example I wanted to share is from a community-based environmental justice organization, and it's centered around community needs that drive implementation. So this community group created a new community farm on land owned by the San Francisco Public Utilities Commission. And this new farm that they created is next to a community park, and both the farm and the park provide space for community members to come together and grow their own food and medicine. And the park and the farm are important health and resilience assets in the community. And so community members created a survey and went door to door to ask residents about their priorities, concerns, and ideas for building resilience and healthy food that the farm and park can help with. And so they collected all of this data and came up with specific strategies to improve the health and resilience of community members that was informed and developed by residents, including a lot of youth. And throughout this project, residents were able to increase their capacity to participate in resilience planning and implementation and create health and resilience strategies that meet community needs in a culturally relevant way. And so our report provides specific recommendations on how to understand community identified needs and ensure that implementation strategies take them into account. Next slide. And so analysis of the policy plan or program is the last step. This involves regularly evaluating the equity successes and challenges of the efforts in order to continuously improve the equity outcomes. This was the hardest step to find examples for. In our research, we reviewed several policies and programs, and an equity analysis was missing from almost all of them. Our report provides some guidance on indicators to track success, and I've provided a list of some indicator categories that can track health and resilience goals on this slide. But in general, first, the indicators should relate back to the goals of the policy or program, and they should account for existing inequities. For example, let's say an indicator for a project is number of homes with air conditioners to mitigate extreme heat exposure and heat-related illnesses. If the indicator doesn't take income or age into account, it doesn't help identify who is most at risk during heat waves. Low-income elderly residents may be at a much higher risk of heat-related health problems than other populations. And so indicators need to be specific enough to account for the heightened risk that vulnerable populations may have, including children, the elderly, low-income residents, people of color, linguistically isolated people, and others. And while the set of indicators will vary project to project, our reports provide guidance on how to develop the indicator sets. Next slide. And so those are the 4 steps of the framework, and I hope the examples I shared explain how equity can show up meaningfully in each of the 4 steps. Our report has many more examples, and it also includes this checklist of questions as a way to start thinking about how to maximize equity. The list of questions that I have up here are in the report, and they can be a helpful way to see how equity is already showing up in the work that you're doing and where it may be missing. Just as a quick example, for goals, one of the first things we ask is, can we be explicit about which vulnerable populations will benefit from your policy or program? And under process, it's helpful to know, how have you designed a process to collaborate with communities in a way that is culturally appropriate and meaningful? Next slide. And here we similarly provide questions for implementation and analysis. So feel free to read the full list in our report. Next slide. And that concludes our presentation. And just to summarize, the main takeaway here is that whatever public health and climate resilience efforts is being developed, these 4 steps can serve as a roadmap to creating meaningful equity outcomes. Next slide. Thank you so much again for this opportunity to share some of our work at the Greenlining Institute. And please feel free to reach out and email me with any questions you might have. And with that, I will turn it over to Pema. Thank you.